All right, welcome to another NREMT Jeopardy from Limmer Education. This is one of three we're going to be doing this spring as we rush towards exam season and people heading for the National Registry. We might just as well do some review for the National Registry, but have some fun while we're doing it as a game. My name is Dan Limmer. I'm the Chief Knowledge Officer at Limmer Education. I'm a paramedic, I am a paramedic, been a police officer, educator, conference speaker, been in EMS and public safety for more than 40 years. If your EMT book is yellow, that's my book. I've written several books in EMS, and I'm here today to help you succeed on the National Registry. So we don't need any more than that about me, except for the fact that we're going to have some fun here tonight. So as we do this, just a couple things. There's a delay when we do this. All right, so I'm going to talk. You're going to see things about 5 seconds later, or see these 5 seconds after I've said them. What I'm going to do is I'm going to ask you to pick topics and categories, type them in the chat. Tell me what you want to do. I'll try and keep an eye on those. And you'll also put your answers in the live chat. That way I'll know you've seen it. I'll know how you're doing. I have some easy ones here. I have some challenging ones here. And let's go through and do this. Now I'm going to start while I'm waiting for someone to come in and pick. And I'm just going to start in the upper left-hand side and be organized. And we're going to do matters of the heart for 100. And I'm going to put on my Jeopardy voice here. Here we go. Acute coronary syndrome consists of these two conditions. Acute coronary syndrome consists of these two conditions. Put your answers in the chat. That's how I know when you got them. This is core American Heart Association kind of material. The National Registry tests a fair amount on the cardiology and resuscitation part, which means they dig deep into these guidelines. I'm keeping an eye out for answers for y'all. And okay, so I have no answers yet. And this is 100. They get tougher as they go on. I know it takes a second. What two conditions are included in the term acute coronary syndrome? All right, we've got answers. We even have the Jeopardy theme going here. What is? I like it. All right, it's okay to be stumped on this. I thought this would be a little bit easier, but hey, listen, this is why we review. The correct answer, myocardial infarction and unstable angina. So acute coronary syndrome is a term that covers things that really look like heart attacks. I figure myocardial infarction, we've pretty much got a total occlusion of some of that coronary vasculature there, some of the coronary arteries. Unstable angina, right? And remember, angina is when somebody exerts themselves, when somebody has chest pain because the heart can't keep up with the demand. Well, unstable angina can happen at rest, and it's hard to differentiate from a heart attack. So these two are put together. All right, so myocardial infarction and unstable angina are in that group classified by the Heart Association as acute coronary syndrome. I'm going to go to the other side of this. Now remember that you can just put in, if you want to do in the topics, matters of the heart. Oh boy, it's OB. Altered states. Different strokes for different folks. Guess what that's about? And miscellaneous medical. I'm going to come over to this side and I am going to choose miscellaneous medical for 100. The appendix is located in this quadrant. The appendix is located in this quadrant. All right, we got some requests coming in. That's good. Oh, and a question for me. Was I a paramedic first or a police officer first? I was a paramedic first. I was actually a public safety dispatcher for 3 years before becoming a police officer. During that time, I became a paramedic and then continued while I was a paramedic with a brief stint as a police paramedic. All right, we're getting some good answers here. I get everybody back on track and feeling good about this. So, the appendix is located in the lower right quadrant. All right, there we go, popping up on your screen, the lower right quadrant. Now remember that organs in the belly aren't innervated particularly well, so when we start to have appendix pain, a lot of times we have it around the belly button, the umbilicus. And then as that appendix gets hotter and starts to bang on the peritoneum, or heaven forbid it ruptures, then the pain goes down into that right lower quadrant. But remember, sometimes the pain is actually around the belly button at first when we do this. Got a lot of choices that came through here. Altered states is coming to mind here. So let's do altered states for 100. Another introductory level question here. About to pop up on your screen any second. There we go. Altered states for 100. This range describes the normal blood glucose level. This range describes normal blood glucose levels. What is the normal blood glucose? We're going to do finger sticks, which most everyone can do. I'm sorry for any New Jersey people here. At the EMT level, anyway. There we go. All right. We've got some great answers coming in here. And as you'll see on the screen, what I have put up here as the normal blood glucose level, which many of you have agreed to, is 70 to 110 milligrams per deciliter. Now, there's a big stress area that people have in this. It's like, oh, my instructor said 80 to 120, right? And said that. So it's like, no, it's okay, whatever it is, because you know what? What you're really looking for is someone who has a lower blood glucose and an altered mental status. Not the 70 or the 80 that makes a difference. You could have somebody at 66 that feels a little bit off and they're a diabetic, and that's hypoglycemic. So the National Registry is never going to give you something between 70 and 80, at least most likely, unless they give you a good story and a reason to do it. 70 to 110 is what a lot of people use now for that normal blood glucose level. Now, as I looked at the requests coming through, I had quite a few, and I thank you all for participating. And one of the requests was to stay with altered states, and we're going to go to altered states for 200. All right, as we go, this condition is described as a transient loss of postural tone. We're in altered states for 200. This condition is described as a transient loss of postural tone. And I guess you have to translate that one a little bit to figure out what that is, but that is the classic clinical definition. Now, if you're looking at it and say, transient loss of postural tone, if I were to translate that for you while we're thinking about this, kind of pass out and fall down is what that means. Transient loss of postural tone. They pass out and fall down. And I'll give you another hint. They tend to get better very quickly. There we go. Just a little translation there, work that. I actually think that this particular condition is one of the most interesting in EMS. Now, I'm going to tell you right now, maybe this is too much information, but I'm a medical nerd. Give me a challenging medical case any day. I'll handle the trauma, I'll do it. But I think a challenging medical case is really where we are. And that is correct. Those of you who said syncope. Syncope is that transient loss of postural tone. You pass out. What happens when you pass out? You fall down. What happens when you fall down? When you fall down, your head is at the same level as your heart. It's suddenly much easier to get blood there, and the person generally comes to. Interestingly, up to 60% of people that go to the hospital with syncope don't get diagnosed with an actual cause. Why? Because whatever it is totally gone most of the time by the time they get there. And EMS do a good evaluation, ask good questions. How did you feel? What were you doing before this? Did you have any difficulty breathing, any chest pain, any concept of palpitations? You're the one that's going to be able to figure this out. So I had a request for different strokes in here, for 100 different strokes for different folks. And we're able to do that. We're going to 100 on that. There are some new things out there, some new mnemonics and things when it comes to strokes. And we're exploring that right now. The E in the BFAST mnemonic stands for what? What does the E in BFAST stand for? Do we have any classes here with us tonight? Might only have one person signing in, but any classes with us tonight? All right, getting some good answers. I want to make sure we take about an hour for these, and at the end, I'm going to go through 2 National Register style questions for some practice for those of you preparing for the National Registry. And we have several good answers here, and the good answers, the ones that are right, involve the eyes. The eyes have it. B is for balance, E is for eyes. And it's important that you remember those. Now, the traditional FAST scale is the facial asymmetry, arm drift, speech, and of course T for time. But adding balance and eyes in there gives us the ability to go a little bit deeper and look at some of those large vessel occlusion strokes, those posterior circulation strokes. What's back there? Our cerebellum affects our coordination, right? Our eyes go from there. So any double vision, any blurred vision, and again, the B for balance and uncoordination are what get us where we need to be. All right, we're going to continue on different strokes for different folks, going down to 200 by request. Now, if nobody requested soon, we're going to have to go to OB. I know we don't always want to go to OB, but it's time we get there. Not coincidentally, I rolled right into this in different strokes for different folks for 200. This term means uncoordinated movements. This term means uncoordinated movements. Have some answers coming in here, or at least one answer coming in here. All right, we're doing good right now. Now, sometimes we will see different variations on words. The one are coming up here for ataxia is totally fair game. You also may see dystaxia. There's actually a series of D's that uh, go around posterior strokes. Dystaxia for the uncoordination, dysphagia for being unable to swallow, diplopia for double vision. So there's a series of D's that are used to describe the posterior circulation stroke. That's why I put the D up there. But think about that balance, double vision, difficulty swallowing, and remember those as you're doing a stroke scale. All right. I'm going to OB. You've got to do OB. Got to get there. And you know what? On the National Registry, some people say, I hardly got any OB. What do other people say? I got 12 OB questions. Some of them were probably pilot questions, but there they are. So here we are with the first question in the 100. For oh boy, it's OB. Full dilation of the cervix to delivery of the baby is this stage of labor. Full dilation of the cervix to delivery of the baby is this stage of labor. You know, somebody put something in there first. If you're looking at the chat, do you go with that person or do you put up your own? We're coming back. We had one answer out there, not quite there, but we're getting it now. And here we go. That is the second stage of labor. The first stage of labor is the beginning of contractions until full dilation of the cervix. When the cervix is fully dilated through delivery of the baby, that is in fact the second stage of labor. The third stage of labor is after the baby is delivered through the delivery of the placenta. Those are the three traditional stages of labor, not just trivia. It certainly is possible to have questions about that on the National Registry. There we go, that second stage of labor. Anything we haven't done yet? We've done everything so far. I'm going to go, keep typing in your thoughts here about what you want to do. I'm going to go to miscellaneous medical for 200. Deep vein thrombosis is the cause of this serious respiratory condition. Deep vein thrombosis is the cause of this serious respiratory condition. While we're getting some answers out here, I'll give you, there we go, we're getting these in here. Interestingly, this condition is classified one of two ways, massive or submassive. Massive is when it kills you instantly, and submassive is when it doesn't. The answers are coming in here pretty good. That concept is the pulmonary embolus or pulmonary embolism. It kicks loose from the lower leg. It comes up through larger and larger blood vessels to the right side of the heart, through the right side of the heart, through a series of smaller blood vessels until it occludes a vessel there. So not only does it affect the perfusion to the lung, if it's large enough, it affects circulation as well. Pulmonary embolus is the answer there. All right, and I had another request for OB. Let's go there right now. If a neonate's pulse remains below this number after stimulation and oxygenation, you should begin ventilations. If a neonate's pulse remains below this number after stimulation and oxygenation, you should begin ventilations. You know, it's interesting. There are two numbers here. There's one number, if it's below, you should begin ventilations. But if it's really low, you should begin compressions. So the correct answer for this one is 100 per minute. If the baby's pulse is below 100 a minute, we're going to begin ventilations. If it's below 60, we're going to start compressions as well. As well. So when we do this, it's important to remember. Now, how do you do this? getting a pulse is kind of difficult. Take your stethoscope, that little baby side, put it over the heart and listen, right? And you know from doing CPR, staying alive is 100. So you can say if it's below 100 and you've dried, warmed, and stimulated the baby, you tried a little bit of oxygen, assuming obviously they're breathing, and you can't get that pulse up, remember, kids respond to hypoxia by bradycardia. And relative bradycardia, below 100, we ventilate, below 60, we compress. Very good. A very important question. All right, you want to do a 500? Let's do a 500. Let's do, oh boy, it's OB for 500. Let's just live on the edge here tonight. This type of massage is used to slow postpartum hemorrhage. This type of massage is used to slow postpartum hemorrhage. Incorrect answers would be therapeutic, Swedish relaxation. Sootheraptor. Got some good answers here tonight. All right, we're getting it. I thought this would be a hard one, but I can't fool you guys at all. The correct answer here, which we're seeing come through, is in fact the fundal massage. The fundus is the top of the uterus. Of course, the uterus is nowhere near as big once the baby has been born. But doing fundal massage, finding where that uterus is there and doing a little bit of kneading and squeezing massage can release hormones that may slow bleeding. I've personally done this before and had a little bit of success the first time we did a field delivery. So fundal massage of the uterus to see if we can stop that postpartum hemorrhage. Some is normal. If you believe it's excessive, this is one thing that we have in our bag of tricks to keep doing that. All right, and I had a request since I was doing the 500s, matters of the heart for 500. We can do that for, she's the raptor. She's been doing great answers. Let's do this. This group of medications ending in OLOL is used for cardiac rate control. This group of medications ending in OLOL is used for cardiac rate control. How many babies? Holy cow. How many babies have I actually catching is one that, how many have you been on scene? 4 or 5 probably over the years, and a lot of them were as a police officer, in the parking lot of the police station, and when I was 18 was my first one. That was one that I always remember. All right. Good answers, good answers, good answers. The correct answer here is beta blockers. Atenolol, metoprolol, labetalol, propranolol. Those OLs are beta blockers. We know that beta 1 stimulates the heart. It increases our rate and our force of contraction and our cardiac conduction. So what do we do if we want to slow the heart? We slow the heart by blocking that beta is one method to do that. If you go and find a person and they're in a nursing home, or if they're an older person at home, and you say, hey, I'm Dan, I'm from the ambulance, you reach down, you feel their pulse, and it's going boom and boom and boom, 1,000, boom. It's like 56, and it's just going along, it's going bam, it's amazing. You say, are you taking a beta blocker? Because that 56, if it's not a beta blocker, I'm going to be a little bit concerned. So sometimes you can just feel that pulse of 56 to 60 in an older patient. Not that I can talk with this white beard, but no beta blockers yet. That's sometimes you just feel that heart rate. And you want to make sure that, is that a bradycardia or is that done by something like a beta blocker? All right. Let's go back to strokes. I don't see any other choices here. Strokes for 300, different strokes for different folks. This abnormal heart rhythm is a common cause of stroke. This abnormal heart rhythm is a common cause of stroke. Going for the big money here. We're going to do some 500s. Yeah, look at you. Look at you all go. Do you know that about 2/3 of the blood in the atria drops into the ventricles by gravity? And that the squeeze of the atria only delivers the remaining part of that blood. That's why this rhythm doesn't kill us. Now, the correct answer is atrial fibrillation, or AFib, a rhythm that's irregularly irregular. I was on a call last week and I felt this woman's pulse. It was syncope. That's why I like syncope. And her pulse was all over the board. I said, "Do you have atrial fibrillation?" And she goes, "Oh, yeah, I do." And you can tell that really out there rhythm. It's not always atrial fib, but sometimes you can tell. This causes, because it does the ventricle, the atria don't get a good squeeze, blood clots can build up on the walls of the atria. They're called mural thrombi. Murals hang on the wall. And if they kick loose, when they come out of the left side of the heart, they come out of the left side, they go up through the aorta. And at the aortic arch, at the top of the aorta, are vessels that go to the head. If that clot travels up, that's how a stroke happens. How do we prevent this? If somebody says they have atrial fibrillation, you say, "Do you take a blood thinner?" Blood thinners like Eliquis now are very popular. When you're on atrial fibrillation, you should be on a blood thinner because that prevents stroke. See what we're learning here? I had miscellaneous medical request for 500, and the answer is acute pain in sickle cell disease is caused by this crisis. Acute pain in sickle cell disease is caused by this crisis. I think sickle cell disease probably isn't talked about enough in EMS. It can be a very debilitating and serious disease. And, sometimes people start responding right away and you know these, other times you don't. Let me just talk about this. The nature of there we go. There we go, Kate. The concept here is called a vaso-occlusive crisis. And what happens, because of that sickle shape of the red blood cell, they sometimes clump and they get caught. Not a clot, but they get stuck in vessels. And that causes hypoxia. So those cells don't always travel the way they should. They occlude vessels, causing hypoxia. It's called vaso-occlusive crisis. Now, this can happen in extremities, can happen in the chest, can happen in the belly. It can cause priapism, a persistent erection. And these are very serious things, and they cause a lot of pain. So we need to take care of that pain if we can. But the acute pain in sickle cell disease is caused by vaso-occlusive crisis. And it's important to remember those. All right, we had a request for different strokes for 500. We're going for these 500s now. Let's do it. Stroke patients must be transported to a hospital that has this capability. You can administer clot busters without it. Stroke patients must be transported to a hospital that has this capability. Can't give TPA without what? This isn't something EMS can do. Yeah, we want to get them to a stroke center. What do they need to do in the emergency department or in the hospital before they give that drug? Now, a stroke center would have this capability. I was on a call recently where, as a first responder of the fire department, we had a stroke and we started bringing the patient downstairs before the ambulance got there and said, we really have to go. And this person's head was in this device within half an hour. And that device is called a CT scanner. That while there's a difference in presentation between hemorrhagic strokes and ischemic strokes, usually you need to get that patient into a CAT scanner, into a CT scanner. That's why hospitals in your area, if their CAT scanner's down, they'll make an announcement, because stroke patients that come there aren't going to get the care that they need as they go along. All right, we're a little behind in matters of the heart. Let's go here for 200. The sign observed when a patient has a closed fist to their chest. The sign observed when a patient has a closed fist to their chest. What is that called? For trivia as we go, this generally correlates with a higher degree of chest pain on our 1 to 10 scale, often 6 or 7 to 10. When this sign occurs, named most likely after the doctor that coined the phrase, we of course know that not everyone, older patients, diabetics, may not have chest pain. We should always ask people about discomfort and other things. Nice job. I can't fool you, even with the nooks and crannies. Really nice job there. That correct answer is Levine's sign. Dr. Levine coined that. It's a closed fist to the chest correlating with a relatively high level of pain or discomfort. All right, so I had a request for altered states for 500. Wiping out this 500 level. Here we go. A type 2 diabetic with a blood glucose of 796 has what diabetic condition? A type 2 diabetic with a blood glucose of 796 has what diabetic condition? There's a couple of ways that you can get the condition from this, from what's given. All right, I'm going to go with Kirk on this one, looking at my my responses in the chat here. Actually, Kirk, HHS I think is the current one. HHNK, HHNS were a little bit older ones. But yeah, here we go. Hyperglycemic hyperosmolar syndrome, or HHNK, HHNS, non-ketotic syndrome. Why? Well, first of all, patients with DKA rarely don't get as high as this one, like 796. Why? Because the acidosis is a little bit self-limiting. Type 1 diabetics, type 1, don't have any insulin, so they have to go much more quickly into digesting proteins and fats, which lead to the acids, which are self-limiting. But a type 2 diabetic probably has some insulin. They may have insulin, but just have insulin resistance. And that gives them enough where they don't have to go into those alternate fuels, the proteins and fats. They can get some glucose and they can let that sugar go up really, really high. Again, because type 2 diabetics probably still have some glucose and they either don't have ketoacidosis or have less, letting the blood go way, way up. Now, depending on your blood glucose monitor, at 700 or 800, it might just read HI, and we don't know what it's going to be. But the concept of hyperglycemic hyperosmolar syndrome happens more frequently in type 2 diabetics and often has higher blood glucose readings. All right, nice job. So we're getting this puzzle down. I'm going to matters of the heart just so we can get that done. Doesn't seem like the most popular topic here tonight. To rescue a child, CPR is performed at this ratio. To rescue a child, CPR is performed at this ratio, compressions to ventilations. I put these in, and it doesn't matter to me whether you're a EMT, AEMT, or a paramedic, you're going to get some of these questions. Just that cardiology section, there's a lot of stuff to do. We got some great answers in there. We did talk about neonates earlier too, and that's more different. 2 rescue a child CPR is performed at 15 compressions to 2 ventilations, 15 to 2. 1 rescuer is the same as an adult, 30 to 2. Now, when you get to neonatal resuscitation, 3 to 1. All right, so just to keep that in perspective, that neonatal stuff, we kind of skate around and don't do as much as we should, but 3 to 1 for neonatal. All right, so 15 to 2 is the answer here. Let's wipe out some of these 300s. Going to the other side of the board, miscellaneous medical for 300. You know I'm evil. I sit around and make up these questions. Think this was a hard Jeopardy if you've been to others? I know some people's name I recognize from before. This challenging, not challenging? The one we're doing in 2 weeks, you want it more difficult, less difficult? Tell me. Pleuritic chest pain and absent lung sounds at the apex cause you to suspect this condition. Pleuritic chest pain and absent lung sounds at the apex cause you to suspect this condition. One article I saw about this condition said that pleuritic chest pain is, if not the most, one of the most common symptoms, and up to 85% of people with this condition get pleuritic chest pain, pain that changes with breathing. Hi, Tracy. And the answers coming in are great. It's pneumothorax. That's absolutely right, the correct answer. Why do you have absent lung sounds at the apex? Because remember, air is in that pleural space. And what does air do? Air tends to rise. Make sure you listen to the apex, the tops of the lungs. And when you auscultate the lungs, listen to one side, then listen to the other side in the same place so you can compare. And remember, pneumothorax can be very, very small. Sometimes they don't even find them at the hospital. They see them on an x-ray. So pneumothorax is the answer there. Very good. All right, going back to OB for 300. This condition is the only time you will insert gloved fingers into the vagina. This condition is the only time you will insert gloved fingers into the vagina. There's a very important reason for doing this. In this condition that I'm looking for, you will also raise the mom's hip to try and keep the baby from exiting the birth canal. Use gravity, hopefully in your favor. Yeah, there we go. Sneakerhead. Everybody's got this. The correct answer is prolapsed cord. Now, as the baby, the cord is the presenting part here. You expose the mom and you see a loop of cord coming out of the vagina, and you realize that baby's going to be coming down the birth canal, and all that time cutting off the circulation from the placenta, from their head. So what do? We have to get that head off the umbilical cord. And we do that with a couple of fingers. We can hopefully keep that head. And you know what? All the way to the hospital till we turn that patient over, we have to keep that head off the cord. Raising the hips may help a little bit with a little bit of gravity and pushing the baby backwards. But that is the only time that we do that, prolapse cord. This can sometimes, when people have test questions, can be confused with nuchal cord. Nuchal meaning neck, cord wrapped around the neck. That one we can usually fix. All right, we have a 1-300 left at altered states. You guys are doing awesome. The tonic portion of a tonic-clonic seizure involves this action. The tonic portion of a tonic-clonic seizure involves this action. We talk a lot about tonic-clonic seizures, really now a generalized seizure. Our seizure classifications change every once in a while. Old timers might remember petit mal and grand mal seizures. We've changed it now to generalized seizures that involve both cerebral hemispheres and an alteration in consciousness. What we don't often think about is what this tonic-clonic really means. Because at the beginning of a seizure, the tonic part actually involves a little stiffening or rigidity. That's the tonic part. And what we find sometimes is patients who have seizures, because of this rigidity, fall and injure themselves. Like syncope. Sometimes you feel you're going to pass out and you can lower yourself to the ground a little bit. But this tonic part of the seizure is rigidity. Clonic is that contraction of paired muscle groups. That's the contraction is the clonic part at the end, but very short, but in the beginning, and we call those tonic-clonic seizures. That involves a certain amount of stiffness or rigidity before that actual seizure happens in the muscle contractions, especially involving some of the paired muscle groups. All right, coming through, we've got 5 left and then 2 National Registry style questions. I'm going to stay right here and finish up altered states for 400. This symptom involving a false belief is seen in some patients experiencing psychosis. This symptom involving false belief is seen in some patients experiencing psychosis. We had a lot of people come in since we started this. Welcome, everybody. I'm glad you're here. What are false beliefs? It might be that you are being persecuted or followed. It might be that you believe that you're a very important person or a religious figure. Had a number of people over the years tell me that they were God or Jesus and that I was the devil. These false beliefs are called something. Kaz came up with a good answer there. Hallucinations are sensory perceptions. The most common hallucinations are actually auditory, things you hear. Actual visual hallucinations are a little bit more rare and often involve drugs. But this false belief that we're talking about is called a delusion. Delusions of persecution, being followed, or somebody's after you. Delusions of grandeur, that you're the president, or that you're God. That these are false beliefs, and they're part of the things that can be involved in psychosis. Now, psychosis is a loss of touch with reality. That is the primary symptom of the disease that involves psychosis, called schizophrenia. Different strokes for different folks for 400. Delusions was the answer for that one. Let's see what we have here. This term means the muscles used to create speech aren't working properly. What term is it that means the muscles used to create speech aren't working properly? You'll notice in this Jeopardy, I focused a little bit on terminology. And I am in several Facebook groups of people that do National Registry study and preparation, the NREMT study group and the EMT paramedic study group and a lot of different groups. And what people say repeatedly is they came out and there were words, I think they were Latin. I didn't know what half the words were on the test. I think in class, we don't do anybody a service if we use words. If we say, oh, the capillaries are leaky versus capillary permeability. So that's why I'm focusing on some terms here. I think knowing terms makes a difference. The registry uses clinical terms. We should do it as well. Now, there's dysphagia with a G is difficulty swallowing. This one is dysarthria. This means the muscles used to create speech. Now, don't forget the concept of aphasia or dysphagia, and that is a concept neither interpreting or using speech. Receptive aphasia means you can't take in what people say and process it, right? Expressive aphasia means that you can't put out the words. Dysarthria means that your tongue and your lips won't move to be able to get the words out, because being able to speak involves moving your mouth and your lips and your tongue. Your tongue hits against your bottom lips, against your palate as you say different letters. Dysarthria is the muscular part of that. Dysphagia is the interpretation or ability to express that comes directly from the brain. Yeah, and you know what? Oh, you support each other in these things. This is awesome. Yeah, so this is why we do this terminology. I believe it really makes a difference. Let's keep going over to miscellaneous medical for 400. Fluid, it's getting to be the end of the game. Fluid accumulation in the abdomen from cirrhosis or heart failure. Fluid accumulation in the abdomen from cirrhosis or heart failure. What is that called? The belly collects a lot of fluid. Now, if we are in heart failure and we don't get up and around a lot, it might not be in our ankles. It might actually be in our belly. Good job. Got a couple good answers there. That that fluid accumulation. I've also seen this. Had a patient with both cirrhosis and pancreatitis, a drinking issue, and the belly was so distended and there's so much fluid in there you could tap the side of the belly and see a fluid wave go through. And that is in fact, as we are saying in the chat from our usual good answers, that is ascites. Abdominal ascites is fluid accumulation there, and there's a couple of reasons for it, and I put a couple of them on the screen: cirrhosis or heart failure. And these patients can actually be quite sick. All right, coming back over. Miscellaneous medical didn't go off the screen, but it will. And let's go to OB for 400. Wrapping down, there's only two more choices. Ventilation of a neonate is performed at this rate. We do have to ventilate that neonate if the pulse drops below 100, or maybe they're just not breathing well at all. What rate do we do it? We already said if we're doing compressions, it's 3-to-1. But if we're just ventilating, what's the rate? And I'm doing this neonatal stuff because it's a nook and cranny. It's stuff that you don't always get taught. You don't remember. It's part of a lecture, which is only one night in a very big class, or one session in a very big class. And this rate is different than you get for children. Children picked up to 20 to 30 per minute. But this is even faster. That's a hint. Right? Kevin put up the upper end of this rate. About every 1 second is 60 times a minute. The neonatal resuscitation program in the Heart Association says 40 to 60 a minute. That's every second to second and a half. And like everything else, just enough to make the chest rise, right? So it's a lot, and it is fast. All right, the final question tonight before we go to a couple sample National Registry questions, because that time is rapidly approaching for everyone. Erectile dysfunction meds. The names of those meds end with this suffix. What suffix is at the end of all of those erectile dysfunction medication names? It's important that we know these because, well, there are medications that we don't want to give here within a certain time limit. Some of the medications now are generic, so we need to know these names. All right. We're getting these names here. And that is, you're correct in that. Technically, it's AFIL, sildenafil, tildalafil, AFIL on the end of these. There are actually about 4 on the market. There's a new one, like a talafil. There's a newer drug out there. But AFIL is on the end. If you see those, using caution with nitroglycerin. I've been talking to people that had questions. How long should you wait? And a lot of sources say that after Viagra, you're probably okay. Sildenafil, you're probably okay after 24. Cialis is a little bit more longer acting, and some people say 48 or longer. Do whatever your protocols say to do this. Generally, 24 to 48 is what people say as the answer for this. Well, that gets us to the end of this Jeopardy! I know we did miscellaneous medical, even though that one didn't go off. While I'm switching over here, I'm going to put up a National Register style question. Tell me what you think. Was this easy? Was it difficult for you? Did you learn from this? And in 2 weeks, when we do Trauma Jeopardy, tell me what you want. Tell me, was I at a good level here? Harder, easier, more challenging, more tricky, more terms? What would you like? And now I'm going to put up a National Register style question, but please tell me what you thought of tonight. Here is, keeping this pediatric, this oh boy, it's OB theme, there is a National Registry question on your screen. Type in the answer that you believe is right. And again, don't forget to tell me what you thought of tonight and what you want me to do for trauma in 2 weeks. So you're assessing a newborn 1 minute after they were born. Their body is pink and the extremities are blue. They have a strong cry, some movement of their extremities. They withdraw their foot when you tap it. Pulse is 168, respiratory rate is 56. You should suspect they. Now we got a lot of different answers here. So if you're looking just from an Apgar standpoint, the body pink and the extremities are blue, you lose 1 point. They get 1 there instead of 2. It's called acrocyanosis, and it's really, really common, right? What we like here is that they have a strong cry. That's 2 on the Apgar scale. Some movement of their extremities gets you 1 instead of 2. They withdraw their foot when you tap it. That's great. Pulse is awesome. Respiratory rate is awesome. You should suspect that this is basically a healthy newborn baby 1 minute after they're born. All right. That strong cry means they're going to bring some oxygen in and they're going to pink up. If they don't pink up in a few minutes, okay, we can give them some blow by and get their extremities a little better color. But this is 1 minute after the baby's born, and that's a pretty smoking Apgar for 1 minute. Nobody comes out. Apgar, remember, 0, 1, or 2 for 5 criteria. Max is 10. You're looking at a 6 or 7 here easily 1 minute after birth. You know, people aren't born at 10 on the Apgar scale. That the tachycardic one, I mean, technically it's over 100, but the relative tachycardia for this baby, 140 to 160 is awesome. Remember, if it's under 100, we're going to ventilate, right? And a respiratory rate of 56, we think it's coincidence. I asked the question about what rate we ventilate newborns at, 40 to 60, and here you've got a respiratory rate of 56. So that's in that range that we're going to ventilate somebody. They're moving, they're crying, they withdraw their foot, they've got a great pulse and respiration. I'd be much more concerned if that pulse came down to 100, right? A good pulse, a good cry, 1 minute after birth, that acrocyanosis is very, very common. All right, I've got one more National Registry question. Remember, 15% of the National Registry exam is going to be pediatrics. And I think getting some resuscitation, getting some neonatal stuff in here, hits a lot of stuff that you don't get covered in class. And we're doing it in true National Registry style. Here is the last question we're going to do tonight. Trinidad and Tobago. Welcome to Trinidad and Tobago. That's awesome. I also like the numbers have gone up. We haven't had a lot of people leave. It means a lot to me. Thanks for sticking around. Yeah, we got a lot of people giving the right answer here so far. So here's what we have. Dizziness, feels like they're going to pass out. They're not getting perfusion to their brain. You observe urticaria, hives, and angioedema, right? Angioedema, especially happens around the face, around the lips. We have a lot of blood circulation there, and that's where that swelling can really kill us. Starting to have tachycardia, and the blood pressure is 78 over 58. The pulse pressure is right on the edge there. You should. What should you do? Administer an epinephrine autoinjector. Holy cow. Oxygen and transport, they're not going to make it to the hospital. Their throat's going to swell. And especially medications that are taken when they're in contact with the mouth, things that are eaten often do have that swelling around the mouth. And it doesn't matter that he took naproxen for the first time, because that just means that it doesn't have to be an anaphylactic reaction. It can be an anaphylactoid reaction. Non-steroidal anti-inflammatories, the contrast media they put in for CAT scans. You don't have to be prior sensitized to some of those things. So if you looked at that and said, wait, it's the first time, this can't be an allergic reaction. No, anaphylactoid versus anaphylactic reaction. Cold packs to the affected area, nope. Assessing for orthostatic hypotension. Okay, they're dizzying and I feel like they pass out. They already failed that. What do they need with a blood pressure of 78 over 58 and a severe allergic reaction like this, anaphylactic reaction? They need epinephrine. Now, if you're a medic, right, Margie, if you're a medic, don't go for the Benadryl, the diphenhydramine. Don't go for the steroid first. Go for the epinephrine. We have about 140, 150 deaths a year from anaphylaxis in the country because we have epinephrine out there. The ones that die don't get epinephrine, usually until severe respiratory signs and symptoms start. So the correct answer, choice B, administer an epinephrine autoinjector. Hey, I'm going to be online again Wednesday night. EMTreview.com is a site that we have which helps people prepare for the National Registry. Every week I go over National Registry style questions, and you're welcome to be in these sessions. My next one is Wednesday night, 8 o'clock Eastern time. I do these every week. This live session, EMTreview.com, paramedicreview.com if you're a paramedic. We've been redesigned, and this site, EMTreview.com, paramedicreview.com, have all the new National Registry style questions included. We've got diagnostic tests. We have video tests where you take 5 questions and I explain them to you just like this. We have a set study center. We have study guides. You want some guidance, don't know what to study, don't know how to study, we've got that for you as well. We've worked really hard on this site. Thank you very much for this, and I will see you in 2 weeks and maybe even Wednesday night for my live online National Registry training.